and welcome to my channel, Midwife Louisa, where we chat about all things midwifery. Before we start, I'd just like to thank you all. I hit 1 million followers last week and I'm really excited. So yeah, thank you for your support since I started my channel in January 2018 at Notre Dame University. And sadly, as many of you know, I'm due to finish my channel this year in June. But yeah, thank you for all your support over the years. So in my last video, a lot of you commented that you wanted me to do a video about shoulder dystocia, as many of you have been affected yourselves from a shoulder dystocia, or you had a friend or family member that had been impacted from having a shoulder dystocia during their birth experience. So today I will be talking about a shoulder dystocia with you all. Shoulder dystocia and the incidence of having a shoulder dystocia in our society. Secondly, we will be discussing how is a shoulder dystocia managed. For example, if you previously had one and they did all of these things to you, like chucked your legs in the air, we'll just talk about the process of how a health professional manages that. And thirdly, we'll be discussing any risk factors that a woman may have that increases her chance of having a shoulder dystocia during her labour and birth experience. Fourthly, we'll be just taking into consideration your health as a mum and how a shoulder dystocia can affect you, and the impact it may have on you in your future pregnancies. And lastly, fifth, we'll be discussing where you and your family can seek help if you've had a traumatic experience of having a shoulder dystocia. So yeah, we'll be going through all the available resources within Australia for mums like yourself. What shoulder dystocia means is that as the head of your baby is delivered outside the pelvis, just like so, the shoulder, this part here, gets stuck behind the pubic bone. Prior to this point, your baby's head may have been what we call turtling, which health professionals are trained to recognise. So when I use the term turtling, I mean the baby's head might have been bobbing, so coming back and forth, just like that, prior to its shoulder getting stuck behind the pubic bone. So a shoulder dystocia is considered an obstetric emergency. If the baby is stuck, they can't breathe, and the umbilical cord may be squeezed. They will need to be born quickly so they can get enough oxygen and are able to breathe. Baby between 2.5 to 4 kilos, the incidence of shoulder dystocia is from 0.3 to 1% of births. So that's an average of 1 in every 150 babies born. When your baby weighs more than 4 kilos, the incidence of shoulder dystocia increases to 5 to 7%. And if your baby weighs more than 5 kilos, it is at much higher risk of having a shoulder dystocia. It's very important to remember that 60% of shoulder dystocias have no risk factors and occur in a normal sized baby. So your midwife is always prepared for a shoulder dystocia at every delivery. And importantly, as soon as your midwife diagnoses shoulder dystocia, she will start to manage it straight away. Baby being deprived of oxygen for a long period of time, to prevent any brachial nerve damage to your baby, as well as avoid any injuries to you as the mother and your baby. There are many ways that a midwife manages a shoulder dystocia. As soon as they diagnose your baby as having a shoulder dystocia, they will call for help. Next, they flex your legs so your thighs are against your abdomen. This relieves 40% of shoulder dystocias. And if that doesn't work, the next step a midwife takes pressure above your pubic bone. This is in hope of releasing your baby's shoulder under your pubic bone. This works for 50% of shoulder dystocias. These manoeuvres are designed to increase your pelvis's diameter and unstick your baby's shoulder. So once the midwife has tried the legs and the external pressure on top of your pelvic bone, the next step she will take is rotational manoeuvres So these are other manoeuvres that help release your baby's shoulder from under the pubic bone. The next step may be to roll. Your midwife may ask you to roll, or have asked you, if you've experienced a shoulder dystocia and you're watching today, to roll onto all fours. You may have also been asked to repeat these manoeuvres if they didn't work the first time. So just rolling alone opens the pelvis by 30%. Manoeuvres are designed to increase the pelvis's diameter and make more room to deliver your baby. As we said earlier, 60% are unexpected. However, be reassured, if your midwife is concerned that you may have a shoulder dystocia, she will anticipate this and be prepared for a potentially difficult delivery. The main risk factors for having a shoulder dystocia include having a large baby, diabetes during pregnancy, having a previous shoulder dystocia, an elevated BMI, and an increased weight gain during pregnancy. It's really important to be aware of the brachial plexus injuries incidence as well. So a brachial plexus injury occurs between 7 to 20% of deliveries complicated by shoulder dystocia. However, it's very reassuring that by 6 to 12 months, these babies have fully recovered. So if you've had a shoulder dystocia, your midwife will ensure you receive excellent perinatal care just in case you've had a tear or had an episiotomy. She will have debriefed with you and hopefully with an obstetrician as well. She will ensure you have enough painkillers so you aren't in pain. She will provide you with emotional support, and if your baby needs to go to the special care nursery for closer observation, she will be able to keep you informed of your baby's progress. Your midwife will always provide to you the best care possible. Some key points I would like to make about my educational video that I've presented to you today include: first of all, a shoulder dystocia is an obstetric emergency. However, midwives are excellent in managing them and have been trained to manage them. They are very rare, and midwives are trained to detect risk factors, and when these risk factors are present, they will inform you of what this might mean for your birth experience. If you've experienced a shoulder dystocia, you may be wondering where you can find help. Luckily in Australia, there are excellent resources available to new mums who may have experienced a shoulder dystocia, where they can find support and help in the community. So many resources online where mums can find help. Panda is an excellent resource. Other resources include Perinatal Wellbeing Centre, your own private counsellor, your midwife, online forums such as Facebook, your mum's group, Beyond Blue, the White Cloud Foundation, the Pecan Tree Perinatal Wellness, Mum for Mums Online, the Centre of Perinatal Excellence, and lastly, Gidget Foundation Australia are all excellent resources online for you to seek help from. Thanks for watching, and remember to like, comment and subscribe. #MidwifeLouisa. Bye! See you next time.